with a diagnosis as serious as cancer, you want the best tests and equipment available. Dr. Sandeep Shah from Austin Radiological Association is here to tell us a bit more about them and some of their imaging services that set them apart. Good to see you, Dr. Shah.
Thank you. Nice to be here.
So what are we focusing on today?
CT lung screening.
Okay, what exactly does that mean?
So this is a diagnostic test that we use to look for potential cancerous nodules in patients before they actually have any symptoms of lung cancer.
Okay.
Okay, that's important because lung cancer causes the most number of cancer deaths for both men and women.
Wow.
Okay. So we use this lung screening test to proactively look for potential cancer in what's called a high-risk population.
Yeah, so who is it recommended
Smokers
for?
mostly.
Okay.
That matters because it's 90% of lung cancers are believed to be attributable to smoking.
Wow.
Okay.
So you have some visuals to show us,
I do,
right?
I do.
Okay, what are we looking at here?
So this is normal lung. Okay. Now, it may not be readily evident, but basically these are the normal soft tissues and air-filled spaces that are the lungs.
And I just want to make sure I understand that. So these are the lungs right here?
Yeah, so
okay.
these are the lungs, okay? Lungs, heart, aorta, backbone, just to kind of localize everything.
Gotcha, and this is fairly normal, you're
Just
saying?
a normal lung.
Okay.
You got it.
So there's more to look at, right? Okay.
There's more to look at. So these are the lungs of a patient with emphysema. What you may notice are there's these black spaces now, like right here, okay? Fairly mild emphysema in this patient. So the black space represents destruction of normal lung tissue, which is caused by, what do you think?
Smoking.
Smoking.
Okay.
You got it, okay? The next image is that of a patient with severe emphysema. Okay. What's evident in here is that there's increased number and sizes of these black spaces, or the dark spaces, okay? So that, again, represents increased lung destruction caused by smoking.
So I have to be honest with you, to me it all kind of looks dark.
Right,
so I'm
right.
guessing you guys are the experts and you know how to translate this.
Yeah, so it's a long training program. We look at thousands and thousands and thousands of CTs, so we ingrain these images in our head of what normal looks like and what abnormal looks like. Okay. So moving on here, so this is what we look for in these CT lung screening exams. Top of the image is a tiny 4mm nodule.
Oh, okay.
Okay. When we see this, we can issue follow-up recommendations. Okay. That's to make sure this tiny nodule doesn't grow up to be a lung cancer. Okay. Now, not all nodules are cancer. That's important to know.
That is good to know.
But we don't know unless we follow them over a certain period of time.
Gotcha. Very informative.
Another example of a nodule, this one is smaller, a little bit larger, it's 5mm. Again, this will need to be followed up.
And when you say followed up, that's just staying in touch with your doctor?
Well, we have very clear follow-up recommendations, and they vary based on the size of the nodule. And that in our report when we send out, we put on there exactly when we recommend the follow-up.
Okay.
Okay.
What do we have here?
So when we're looking at these, it's also important to know what's benign and what's potentially not benign. Okay. So in this case, we have this very bright nodule down here. It's what we call a calcified nodule. This is benign.
Oh, okay.
We don't worry about it. We don't even think about it again. Okay, we'll just move on. So that's important to know too. So this is a very large cancer in the right lung. This big mass right here.
Yeah, that looks scary.
Now, what you may notice is that this image is less bright than the other ones I've shown so far.
Yeah.
Okay, that's because what we do is we utilize different ways of looking at images called windows to assess all parts of the patient's anatomy. So this is what's called a soft tissue window. And then on this, our last slide, this is what's called a lung window. Okay, this is the same mass, same patient, but we see in a different way.
So with all of this, I'm wondering, what are the radiation effects when you're doing screenings like this?
There is radiation, okay, but with ARA's new low-dose scanners, we can reduce that by up to 60%.
Oh, wow.
Okay. Not only that, but it has no adverse effects on image quality. Okay, but kind of the more important point is that the advantages of early detection of lung cancer far outweigh the small radiation you may get from this exam.
Yeah.
And just also, I'd like to point out the people who are qualified for this exam. Okay, it's a certain subset of patients. It's 55 to 77 years old.
Okay.
Okay, what's called a 30-pack year history of smoking, and I'll explain what that is. And either currently smoking or have quit in the prior 15 years.
Okay.
The 30-pack years is smoking 1 pack per day, or the equivalent of smoking 1 pack per day for 30 years.
Wow.
It's a lot of cigarettes. So, if you're in that category, this would be a great test.
You want to be really proactive about your
Yes,
health.
you
Dr.
do.
Shah, thank you so much
you.
for
Nice
being
to
here.
be
We
here.
appreciate it. So where can people find you guys?
Online, we're at www.ausrad.com, AUSRAD.
And there's the number if you want to give them a call, make an appointment, or just ask some questions, maybe some follow-up from the things we just learned. Appreciate it.